Hi everyone, I am Junela Likaway and I'm discussing about the problem in teenage pregnancy. Teenage pregnancy is a global reproductive health promotion problem that affects teenagers in our society. Both developing countries have children that age 10 to 19 years old and unmarried, still at school, but they become pregnant. The problem why teenagers become pregnant because of lack of parental care. Second, lack of school fees. Third, also desire for a child forced marriage. And you, as a parent, would you allow your daughter or your child to advertising herself to other people? Of course not. Because as a parent, you should guide your daughter or your child to become a good person or a to become independent person. So to avoid this kind of problem, guide your children and give time to them so they can avoid the bad influence people. Now, let's tackle the possible disease in teenager pregnancy. This statement is from the obstetrician or gynecologist that early pregnancy can cause increasing risk of anemia, preterm labor, urinary tract infections, or in short, UTI, and hypertension, preeclampsia, and high rate of cesarean section. But the preterm birth and low birth weight that gets in your baby. This could be the possible disease in teenage pregnancy. And now, let's discuss all the disease in teenager pregnancy. And the first is anemia. Anemia is occurs when there are not enough red blood cells to carry oxygen to your body organs. And the result of that problem, you can feel cold and tiredness or weakness, but the common type of anemia is iron deficiency anemia. Preterm labor is a labor that starts before 37 weeks of pregnancy, so there are the possibility that your baby was less of birth, but does not automatically means that a pregnant will have a preterm birth, because preterm labor needs medical attention right away. And third is urinary tract infection, or in short, UTI. The infections can affect several parts of the urinary tract, but the most common type is a bladder infection, or the scientific name is cystitis. Cystitis. And the kidney infection, or the scientific name is pyelonephritis. Pyelonephritis. is another type of UTI. Remember, UTI is a very dangerous, so you must careful to the food that you eat. And the fifth one is hypertension. Hypertension. What is hypertension? It means your blood pressure is higher than normal. It change based on your what you are doing. So it is basis of you're doing every day, what you're doing every day. Sometimes stressful, so that high blood pressure can cause diagnosis. Preeclampsia. Preeclampsia have a similarity of hypertension. It can cause higher blood pressure, but preeclampsia affects your kidney, your liver. So preeclampsia must most dangerous than hypertension. And the last will be cesarean. I know cesarean is very common to us, but let me explain again to all of you. What is cesarean? It is a kind of surgical procedure by which one or more babies delivered through an incision in the mother's abdomen. The it it performs because vaginal delivery would put the mother at risk. Now we are done discussing the problem in teenage pregnancy, and we already know what are the possibility disease will you get in teenage pregnancy. The lesson of this topic is always be independent and careful of your decision in life so that you can have a better future. And my advice to all that find a programs that help pregnant teens that remain in school or complete coursework from the home, and take up parenting classes and help your teen prepare to financially support and raising a child. And my last advice, do not engage early into sexual activity so that you can avoid to become pregnant in early age. That's all for my topic. Thank you for listening.